All right, today we're diving into a really unique medication in the world of alcohol recovery. It's called Acamprosate, and what makes it so different is that it's not about getting you sober, it's about helping you stay sober.
Anyone who's ever been on this journey knows that feeling. That constant low level hum of anxiety, the restlessness, the cravings. It's exhausting. And it's so easy to blame yourself, to think it's just a lack of willpower. But what if it's not? What if it's actually a predictable biological state that happens when your brain has been thrown completely out of balance?
So, here's the game plan. We're going to start with what Acamprosate actually is, and then we'll get into the cool science of how it rebalances the brain. From there, we'll cover the practical, need-to-know stuff, talk about the real-world risks, and finally, see where it fits into the whole recovery puzzle. Okay, first things first, we need to get crystal clear about what this medication is for, and, just as importantly, what it's not for. And this right here is the absolute key. Acamprosate isn't for someone who's still drinking. It's not for managing acute withdrawal. Its whole job is to support you during what's called the maintenance phase, that incredibly tough period right after detox is over when the real day-to-day work of staying sober really begins. What's so fascinating is how it works. It's not a sedative, it won't get you high, and it's not addictive at all. It just kind of works quietly in the background, turning down the volume on that psychological distress, that inner tension that can make a relapse feel almost inevitable. It's a tool, it's not a cure. So, how does it actually pull this off? To get it, we need to look at what long-term alcohol use does to your brain chemistry. And honestly, the best way to picture it is with a simple seesaw. Okay, so imagine on one side of our seesaw you have glutamate. Think of this as the brain's main accelerator, or its gas pedal. It gets things going. On the other side, you've got GABA. That's the brain's brake pedal. It's inhibitory. It calms everything down. In a healthy brain, these two are in a beautiful, delicate balance. Now let's introduce chronic alcohol use into the equation. Alcohol is a depressant, right? So what it does is it artificially boosts the power of GABA, basically slamming down on the brake pedal of the seesaw. The brain feels calmer, more sedated. But here's the thing, the brain is smart. It craves balance. So if the brake is constantly being pushed down, the brain fights back. It starts piling more and more weight on the other side of the seesaw. It makes the accelerator system, glutamate, way more powerful, just to try and keep things level. And this is the moment of crisis. When you suddenly take the alcohol away, that artificial foot on the brake pedal vanishes. But all that extra weight the brain piled onto the accelerator, it's still there. The seesaw slams down hard on the glutamate side. And that results in a brain that's totally overexcited. We're talking anxiety, insomnia, agitation, and really intense cravings. Acamprosate works by acting like a gentle hand, easing the pressure off that hyperactive accelerator, helping to slowly guide that seesaw back toward balance. So that's the science, which is pretty amazing when you think about it. But let's get practical. How is this actually used in the real world? Who should take it, and what's the daily routine really like? The most important thing here is timing and commitment. This is not a pill you take to help you stop drinking. It's a tool you start using after you've already stopped. Ideally, pretty soon after detox is done. And it really shines for people who are highly motivated and ready to throw themselves into a full recovery program. Now, the recommended dose is 1,998 milligrams a day. That sounds like a massive number, right? But don't worry, it's actually broken down into a really simple, manageable routine. So the routine is just this: 2 tablets 3 times a day. And the advice to take them with meals is brilliant. Yeah, it can help with stomach upset, but more importantly, it helps you build a habit by linking the medication to something you already do every day: breakfast, lunch, and dinner. This table tells a really important story. First, it explains why that dose is so high. Your body only actually absorbs about 11% of it. But here's the crucial part: metabolism. It is not processed by the liver. For someone whose liver might already be damaged from alcohol use, this is a huge, huge advantage. It also means fewer potential drug interactions. The trade-off, though, is that it's cleared out by the kidneys, so your kidney function has to be in good shape. Okay, let's be real. No medication is a free ride. So we need to talk about the real-world experience, from the most common side effects to the most serious warnings you absolutely need to know about. Looking at this chart, one thing jumps out immediately. The side effects are overwhelmingly gastrointestinal. Diarrhea is by far the most common. But here's the good news.
For most people, these issues are pretty mild and they tend to get better or go away completely after the first few weeks as their body gets used to the medication. And now for the really serious stuff. Because it's cleared by the kidneys, it absolutely cannot be used by anyone with severe kidney problems. And like many drugs that work on the central nervous system, it comes with a black box warning. That means it's critical to monitor for any new or worsening depression or suicidal thoughts. This just hammers home the point. You have to be under close medical supervision while taking this.
A question that always comes up is, okay, how is this different from that other medication, naltrexone? Well, think of it like this. Acamprosate is the discomfort reducer. It's working 24/7 in the background to lower that constant tension that might make you want to drink in the first place. Naltrexone, on the other hand, is the reward blocker. It works by blocking the pleasurable buzz from alcohol. So if a slip does happen, it's much less likely to snowball into a full-blown relapse.
So when you put all of this information together, what's the big picture takeaway? Where does this pill really fit into the whole journey of recovery?
The clinical trials on this are incredibly clear. Acamprosate by itself, it helps. Psychosocial support, counseling, therapy, support groups, that helps even more. But when you combine the two, when you have the medication working on the biology and the therapy working on the psychology, that's where you see the absolute best results for long-term sobriety.
And that's really the bottom line. Acamprosate isn't a magic bullet. It's not a passive cure you just take and forget about. It's an active tool. It's a support mechanism that's designed to quiet down all that biological noise from withdrawal, which then gives a person's larger recovery plan the space and the chance it needs to really take root and succeed. And that kind of leaves us with a final, pretty big thought. The more we understand the brain, the more we see just how deep the biological roots of addiction go. And it makes you wonder, is the future of recovery a path that relies not just on human connection and support, but just as much on the power of chemistry to help heal the brain itself?